Hello everyone, my name is Felicity and I'm the Senior Vice President of Marketing at Dignity Health Global Education. I want to thank all of you for joining us today, wherever you are across the United States. I think I might be the only one not in the US, but lovely to have you here, and I'm really excited and delighted to be hosting this info session with our partner at Mercy College Plus, which is the online extension of Mercy College of Health Sciences. I don't know if many of you know about Mercy College, but they are, a value-driven, not-for-profit institution with a shared affiliation with Common Spirit Health, as we do, which many of you I think are from Common Spirit Health, but they are one of the largest health systems in the United States, bringing together CHI and Dignity Health. So we've partnered, we recently announced our partnership in March, long time coming, but we've partnered to truly disrupt and transform healthcare education from entry-level qualifications. Yesterday, we actually announced our partnership and one of our online programs. It's a medical assisting program. And of course, the rn-bsn completion program, which we're going to talk about today. As many of you are aware, there's over 750 of these programs available across the US. And we're here today to discuss what makes our program different, the value it can bring to individuals and health systems alike. Throughout the session, please feel free to drop any questions in the Q&A. So there's a Q&A section at the bottom, or just in the chat, whichever you feel more comfortable with. And then we'll save some time to answer those questions, to go through things. And I'll pop on then. But without further ado, I introduce you to my colleagues. So Professor Kim Oswald and Andy Gress. I'm going to disappear now for a bit, and Kim, if you wouldn't mind kicking off the introductions.
Yes, thank you, Felicity. I'm really excited to be here today. My name is Kim Oswald, and I have been with Mercy College since 2012, working in the rn-bsn program. I am the program chair, and I'm also a professor, teach a lot of the classes in the program, so I'm excited to share information with all of you today. I think we are on a very exciting journey and hope that you will consider joining us on this journey.
Hi, everybody. My name is Andy Gress, and I am the Director of Enrollment Management at Mercy College of Health Sciences. And I'm super excited to be here virtually with everybody today. I know that we have folks joining us really from all over the country. And I think that's one of the most exciting things, Dr. Oswald, about our program is that it's something that started in Des Moines, Iowa, center of the United States. And really through this partnership is going to be branching out. And one, something I want to touch on that I saw in the chat of someone who hasn't heard of us before is we as a college, we actually trace our history of preparing healthcare professionals back to 1899. So we've been doing this for over 120 years. A really cool history at the college, tracing back to our Catholic heritage and the Sisters of Mercy who came across the pond, and they started some missional work in New England. They made their way to Iowa, and that's where our start was in 1899. Here we are today. It's 2021, 120 years later of thousands of healthcare workers that have come through our training, are now out serving. To start, Dr. Oswald, if you could talk about your own journey. So, it started as a nurse, as a practitioner, continuing to seek more education, and here you are today leading a nursing program.
Yes, I certainly appreciate the journey that has brought me here today. I started out as a nurse at the bedside. I worked in a cardiac unit for many years. I also worked in a PACU unit for many years as a nurse at the bedside. And what I realized was there are greater opportunities that can exist at the bedside and beyond the bedside. And so part of my decision was going back to school, and I did get my master's degree in nursing, and said I would never go back to school at that point. However, whenever you say never, you know how that happens. The doors started opening for me to pursue advanced education. And I thoroughly enjoyed when I was at the bedside having student nurses with me. And so that kind of started this journey and this passion of mine to help equip others at a higher level in our profession. And I think that BSN role is certainly a gateway to a lot of opportunities. And so that brings me to where I'm at today. After I finished my master's, said I'd never go back. That didn't last very long because I have a love of learning. And so I continued on. I ended up getting some degrees in education, and now here I am today, working in a very exciting program. And probably, I will have to admit, this is really a highlight in my career.
So I imagine many listening today are practicing nurses. They're evaluating, do I take this next step? What's it going to look like for me? But you work with these, you work with working nurses every day. What is it like?
It's the most rewarding thing. Our students are such amazing nurses at the bedside, and it has been a joy working with so many of them over the years that I've been at the college, and we've been online. We've been online for a long time, so we get that these working nurses are balancing home life, career, and now have chosen to start an academic journey. And so yes, it is exciting working, and this last year has been very exciting with all the pandemic. It had changed the structure for our working nurses. And so we understand where working nurses are, and we become a partner and develop a relationship together as you pursue your BSN degree.
So I have a little bit of experience myself because my wife is a nurse. So I know that you can have 312s, 410s, 8s, BPRN. Nursing comes in many different shapes and sizes. So how does the education and the program work with such varied schedules?
The great thing about the program being online is you can fit it into your schedule. I'm amazed that my students are working at 1, 2, 3 in the morning on their coursework. And so they can work in the middle of the night, you can work during the day. The idea is that this program fits into your life and that you can fit this into your busy home life as well as your work life. And it is doable.
That's fantastic. And the design of the program is, it's a 4-quarter program. The credit load is manageable every term to really look at that year completion timeline, right?
Yes, absolutely. We originally were 15-week courses, but now we're down to 10-week courses, which the feedback that we're receiving from our most recent students that are graduating, they really like the 10 weeks. It goes at a fast enough pace to get through coursework, but it's not too fast. So it seems to fit very well with a working adult. So that's exciting. So in about a year's time, you can have your BSN degree with a very manageable schedule.
You beat me to the finish line. I was just about to ask, what are our students telling us?
Yes.
In terms of the 10-week courses, it's asynchronous learning, like you mentioned. So, if you're doing it at 3 in the morning, if you're doing it at noon, it really does fit nicely into a schedule for a working person, a mom, a dad, a significant other, whatever someone's whatever they're trying to manage. In addition to working, it does fit well nice because of the asynchronous delivery. So what, in the delivery of this program, Dr. Oswald, what have you found that you really think has become a differentiator from our program? As Felicity mentioned, there are hundreds of RN to BSN completion programs, but I know that we believe ours is different.
Yeah, I think ours is different. I have taught in other programs before I came to Mercy College. I think some of the really golden nuggets or the cherry on top of the cake about Mercy College is that faculty really develop that relationship. And I want to tell you, we have a team of individuals that are dedicated to the success of our students. we really care about our students. I have students that have 4 children that are trying to work. I have single parents, and I get to know them as a faculty member. And then we have some awesome resources that help in that journey to their success. We have an amazing student success center. We have tutors that assist with writing and scholarly writing, which sometimes scares our students, but they do very well. We have writing tutors that are very dedicated. So we have a wonderful platform to support student success. I think that's one point. The other thing is, I think our core values that are driven within our institution and personally ourselves. We have core values of compassion, integrity, reverence, excellence, and all of those things support an environment for student learning that I think is different than maybe in some other institutions. And so those things are very important. We also have faculty experts teaching the courses. I can tell you that the faculty in the program have the expertise to teach the courses they're teaching. We've been at the bedside. We've dealt with the issues at the bedside. So we are very connected to the real world. And so I think those 3 things really make us kind of stand out. I can also say that our tuition rate is pretty competitive, I think, if you look at rn-bsn programs. And Andy, do you want to talk about our tuition rate?
Yeah, I would love to. You know, at $2,500 per quarter, completing this program in 4 quarters really brings it to, you know, right about the $10,000 mark. Of course, we always encourage students to, you know, fill out a FAFSA to see what grants are available to them. And I also think too, you know, this program is special in that many, you know, all of the students are working as nurses. Many of their healthcare facilities provide forms of tuition assistance or reimbursement. So it's not only competitively priced, but I think a lot of the students that are looking at the program are really in really a special position to potentially have some of that, you know, the financial cost offset.
I see a couple things in the chat. I wonder if maybe we can bring out Andy. One of them was how do people interact with their peers and maybe faculty in an online setting? That's an opportunity that exists. We have a wonderful platform called Dig, which is a discussion board platform. And we interact every week about current topics within each of these courses. And so I'm interacting with the students are interacting with me. We can also meet individually if need be between faculty and students, and we can have meetings together. But it's really designed so that you do have that interaction with both your peers as well as the course faculty.
And even though that platform, Dig, is academic in nature, it kind of feels like it has a little bit of a Facebook feel where you're commenting on what people write, you can like what what people post, and all of those things have point value to really encourage people to be an active member in the community. So it's really set up in a user-friendly way to engage the students, but also I think to have fun doing it. Yeah. And to be meaningful, but also to be personable. We have smaller classes where students get to know each other. They'll take courses in a way where they'll see people online regularly, throughout the cycle of their education. So I think that's really fantastic. One thing that I'm sure that someone attending today is thinking about is, what is it like to learn as an adult? I mean, I'm working. I already have a degree. I have a lot of knowledge about being a nurse. What's it like for a nurse to learn from a nurse? It's
really amazing. I have to say that I learn from my students every day. And hopefully they can learn a little something from my end too along the way. But they are working adults, and they bring a richness to the academic setting that it's unparalleled because it's in real time. This last year, we had a lot of COVID related things that ended up being discussed within courses. So it's very specifically aligned to today. It's not a dinosaur program. It's not a dinosaur curriculum. It is a current curriculum. So that's exciting to know that these students are going to be interacting about real life things that are happening in the workplace and developing their skills to take that next step if they so choose to do that.
And I think it's just such different learning because, when you're studying to become a nurse, you're learning things for the first time. You're learning anatomy, you're learning diseases, you're at clinicals learning interventions. And now it's really application learning. I've done that. And how does it apply to, a theory of leadership? How does it apply to community health nursing? So I would think it's more fun to learn at this stage because, there's so many experiences that come in that it's not just reading out of a book. It's things are making sense because I'm doing it, and students are really able to contribute.
I agree, Andy. I've been around quite a while, and I wish I had a program like this early on in my career because it is such active, engaged learning. And I think it's something that really opens the windows and the doors for individuals. I teach at the beginning of the program, and I teach the course as they graduate, and the growth that I see in those students, and they reflect on their growth. It's simply amazing. And so it's very rewarding to see students develop their skills to that next level. And I see there's a couple more things in the chat feature, which maybe we will discuss later, but I did want to mention something about the program being 4 quarters and you can be done in a year. However, you can also take it at your leisure. We do have some students that decide to take a summer off because they have a big planned event in their family. And so you can stop out if you need to and come back in as it fits your lifestyle. And so that's kind of nice too, because you can kind of make it fit, again, your entire life.
So speaking of active, engaged learning, I think that's an excellent segue to bring Felicity back and see what questions some of the people have asked in chat, and just continue the dialogue of the program and anything else that people want to know.
Yeah, thank you so much, both of you. I think we've had lots of questions come in, and it's really, thank you everyone also for filling out the polls, so we can really make sure at this stage, we can focus more on certain areas. So actually 2/3 of the audience here today are actually looking for this program for themselves, which is great, so we can really hone in on more specific questions. So please keep the questions coming in. I know some of you putting them in the chat or Q&A, it doesn't matter, we're catching them all. And I'm going to group a few of them together. So people have been asked, so Kim, you mentioned that, obviously it is 4 quarters, but people can take quarters off. And someone said, will I have to pay for that quarter?
Oh, no.
Yeah, I did want to make an assumption, but I was pretty certain.
Yes.
Part of our partnership between Dignity Health Global Education, and Mercy College of Health Sciences, we want to make sure that when I spoke at the beginning about transforming and disrupting, we really want to make sure that there is as little to none out-of-pocket costs for our learners. So I don't know if many of you are actually from Common Spirit Health, but 2 of our board members at Dignity Health Global Education, I think the name kind of gives it away, but 2 of our board members are actually, C-suite at Common Spirit Health. So we've got Kathy Sanford, who many of you may know, and Marvin O'Quinn, who is the president and COO. We really try and work with them to make sure that we are providing, the best options for you in terms of affordability. So like Kim said, taking a quarter out if needs be for either personal reasons and just having that break, or even to make sure you can make the most of your tuition reimbursements, tuition assistance if you have that, to really just try and reduce any fees that you would, typically have to pay yourself and costs. Andy, we've not really mentioned credit transfer. Are you able to give people a little bit of information about that?
Of course, yeah. At all of our programs at Mercy College Plus, students that bring in an associate degree or a bachelor degree meet our core requirements and come directly in to take major coursework. So our RN program is a fantastic example of where students coming in will, with Dr. Oswald and her faculty, be taking major coursework.
Thank you. So a couple of people have asked this question. We spoke about the change to the quarters and them being 10 weeks, Kim, to make it a lot more, doable and manageable. What about actual expectations around study hours? Like, people do, everything that's happened, and homeschooling, and obviously, vaccination rollouts, bedside nurse, everything as, kind of making people still feel a little bit scared about studying and committing that time. What would you recommend is the kind of hourly, weekly study?
Boy, I wish I could put hours on it.
I know,
it depends on the student, to be honest, but I think you have to expect for potentially a 3-credit course, you want to put time in during the week. We do ask that you log on at a minimum of twice a week. Most of our students will work on weekends. Our assignments are typically due on Wednesdays and Sundays, so that gives a little flexibility around when work is expected to be done. So, based on the course readings and based on the assignments, yes, it is a commitment of it is a commitment of extra time, but certainly it is very doable. We've had many students come through the program over the years, and they make it work. As nurses, we just make it work. So I hate to put a time on it because it is so individual.
Thank you. Another question kind of goes back to my credit transfer question, Andy. So someone's asked if they've come from a community college for their associates RN, will they have to retake classes?
That it's probably in regard to science courses and science courses aging out. We do not have age requirements on our science courses, so there isn't a restriction to when someone took a class as being a barrier for transfer.
So yeah, I think a similar question to one that's come through about, what would be the word? So a program that's been studied, quite a while ago, like do things expire? Do courses have to be retaken?
They shouldn't be, no.
No, and by the way, everyone who's asking questions, if we've not quite answered your question, please feel free to ask us to elaborate. I think that's really important to make sure that we are. Are there any clinicals, and if so, presumably so, can they take them at the clinic where they are currently working?
We do have in our community health course preceptor hours, so you will find a location where you will do some preceptor time with a community health type nurse, and those hours can be obviously done you can arrange your schedule for that, and absolutely we would arrange that at your location. So it does have to be a community health type nurse role, so public health departments, school nurses, those kind of things, but we can certainly work with students on that, yes.
Actually, that ties into a question that I had. Where do most of your students come from in terms of states? I mean, obviously you're based in Iowa, but with this being online, we do allow recruitment from any state, so nurses from any state in the US, is that correct?
Yes, I've had students from California, Texas, all over. So, it's one of those things that, yeah, it's exciting to see people from other states participate in the online programs.
And then I don't know, I'll give everyone a little bit more time to ask any other questions, or if we need to elaborate. I think I've addressed nearly, I think I'll hand this over to you, Kim. I think I know the answer. Someone asked, can people take this program if they are not already a nurse?
They do need to become a nurse entering into the program, and that is one of the things that they do need to achieve to get into the program.
Are there any other options at Mercy for people who are maybe looking for a different route, looking to reskill or upskill, but not necessarily this program, Andy? Andy's frozen.
Andy's
frozen. 2021 and the internet, we love it, don't we?
Yeah. We have other health science degrees at Mercy College, such as healthcare administration, we have public health, we have radiology, sonography, so we are a health sciences college. And so if you want to explore more about us, you can go out to our website and see a little bit more detail on the programs that we offer.
Thank you, Kim. And there's another question that's not necessarily about this, about are there higher levels of education provided? In terms of master's level, I'm assuming that question is not at Mercy, but Dignity Health Global Education, we do have a range of qualifications as well. So please do have a look at our website and see. And we've got some master's level nursing programs that are going to be launched, hopefully in the future. I hope I've not given too much away. So I actually have kind of a preempted question. I do apologize, but something that I know is super exciting and different about this program. So our teams collectively have not only been transforming the instructional design, so our aim is to create the best online rn-bsn completion program out there. As we said, we've already, revolutionized the way that we have more of like the social learning and the social aspect to really keep people not only like engaged, but that peer-to-peer learning. So we've already done that. The instructional design and the look and feel of the program, it's so easy to use on a desktop, mobile, and people can honestly learn anywhere. If they need to escape the house with their kids, they could go take their phone and go and sit in a coffee shop. And we really want to make sure that there are no boundaries to the workforce, reskilling, upskilling, and educating. So the really exciting area that we've been developing, that we do have a little slide, it's not a jazzy one, but we know the importance of skills, and Kim and her teams have been working with our teams, and we are so pleased to share with you more information about our badging pathways and what they are and why we love them. So I'm going to hand over to Kim for you to just talk a little bit more about what we've been doing and why.
This is one of the most exciting things that I've been involved in, and I think we are on the cutting edge of this. And what happened was our teams came together and we pulled EMSA data, both at the national and state level, to identify job skills that employers are seeking in BSN nurses. So based on that data, we were able to have some good discussions around some of the most important skills that you're going to need if you apply for a job as a BSN nurse. And so we created these micro badges, which you can see an example here over on the left-hand side. And the micro badges lead up to a badge, which this example shows communication, which ultimately leads up to the big badge, the ultimate badge of being a nurse leader. So these micro badges are placed throughout the curriculum, where students will earn these badges as they progress through the program. And there are eight badges that they will be working towards, and ultimately the ultimate badge of a nurse leader. Then after they receive these badges, they can use this information in seeking their job role as a BSN nurse, and it will align with that EMSA data. So this is so exciting, and these badges are just coming alive within the curriculum. So it's an exciting time, and we are on the cutting edge. We are on the cutting edge.
Yeah, we're all very proud of it, and I think that our pride kind of transfers then into each individual's pride. Like these badges are to be, if you will, worn with pride, you know, online. If you have a LinkedIn profile, very easy to pop the badge on your LinkedIn profile to really hone in and highlight all of the skills that you've learned. You know, obviously the end goal is the diploma, the certificate at the end and your degree. But these are just, you know, this is new. These are, you know, online badges for your skills. So really pleased to be sharing that with you here today. I think that that's it. I think we've answered every question. I obviously just spoke about LinkedIn. I would welcome you to, oh, sorry, yes. So if you are looking to progress for the online BSN completion program yourself, please reach out to my colleague, Tanya Platt. Many of you will have already been speaking to her. We'll just pop her email address in this chat, if you don't mind, Patricia. We'll pop Tanya's and Scott's email address in the chat. My colleague Scott actually looks after more enterprise sales. So if you are looking to speak about the options to train teams, please reach out to Scott. Again, like I said, we'll share the email addresses in the chat. And yes, I want to thank Kim and Andy so much for today. Great discussion. Please feel free, everyone, like if you want to reach out to us directly with any other questions, you want to have a one-on-one with us, please feel free to do so. We spoke about LinkedIn. If you are on LinkedIn, please just take a little photo of this QR code and follow us on LinkedIn. Like I said, we announced a new program yesterday. We have lots of different announcements and really important updates. So yeah, I just want to thank everyone. Thank you so much.